Hello, my name's Cathy Ford. I'm lead specialist practitioner with the Infection Prevention and Control team at University Hospitals Plymouth. As part of outbreak control, patients are often nursed together in bays rather than in single rooms. This is known as cohort nursing. It's important that the donning and doffing of PPE is done correctly and at the right time when you are nursing a cohort group of patients in an outbreak. The basic principles of application and removal of apron and gloves remain the same, but the time that you do it is critical. For cohort droplet isolation precautions used with outbreaks of flu and amber cohort isolation precautions used with outbreaks of COVID, the addition of eye protection using a visor or goggles is also required. We'll start with cohort standard isolation precautions used to manage outbreaks of diarrhoea and vomiting. PPE in this scenario is apron and gloves, with surgical masks being part of baseline uniform at the time of making this film. Prior to entering the cohort bay, apply apron and gloves. Locate the closest apron and gloves dispenser to the cohort bay. Ensure it is kept well stocked, as this is the dispenser you will use to change your apron and gloves during your session of care in the bay. Your surgical mask will be able to stay on for the whole session of care unless it gets soiled or damp, in which case you will need to change it. However, you will need to change your apron and gloves between each patient and between different tasks with the same patient. The aim is to prevent contamination of the front of your uniform by protecting it with an apron while in the cohort bay, but also to avoid cross-contamination between different patients within the bay. This is achieved by changing your apron between each patient. Hand hygiene must continue as per the 5 key moments for hand hygiene. So whenever you get to a place where hand hygiene needs to be performed, then gloves must be changed to facilitate this. As a minimum, this will be between each patient, but whenever you reach one of the key moments, you will need to change gloves. It's not possible to perform hand hygiene while wearing gloves. You have completed the care for one patient and plan to move on to give care to the patient in the adjacent bed space. Go to the clinical hand wash basin located inside the bay, remove your gloves, followed by your apron, wash your hands. Exit the bay and move straight to the closest apron and glove dispenser located outside the bay. It's important to know which dispenser you will be using before you enter the bay for the first time. Apply a fresh apron, taking care not to pull the apron across your surgical face mask. Apply a fresh pair of gloves. You are now ready to re-enter the bay and undertake the care of your next patient. At the end of your session of care, and you're ready to exit the cohort bay, remove your gloves and aprons, wash hands, and remove your surgical mask by grasping the elastic ear loops and lifting the mask forwards and off your face. Avoid touching the front of the mask. Wash your hands with water and soap. Immediately leave the bay. Reapply a fresh surgical face mask. For droplet or amber cohort isolation precautions, you will also wear eye protection. Your surgical mask and eye protection can be worn for a whole session of care unless either gets soiled or damp or vision through the visor is compromised for any reason. Take a visor, remove any protective film in place. Stretch the elastic strap to fit around your head. For the first entry into the bay, apply the apron and gloves as for standard cohort isolation precautions. It's very important not to touch your eye protection or mask while you are in the bay, as doing this puts you at risk of contaminating yourself. If goggles are provided as your eye protection, apply these in a similar way. Ensure any protective film is removed and stretch the elastic strap around your head, ensuring as comfortable a fit as possible. Both the visor and goggles are considered to be single-use and disposable. Changing apron and gloves between patients or between care activities on the same patient with Droplet or amber isolation precautions. You will be wearing your surgical face mask and eye protection as these are sessional use. Move straight to the closest apron and glove dispenser located outside the bay. Take a clean apron out of the dispenser. As you are wearing eye protection, you will need to apply the fresh apron slightly differently in order to avoid pulling the new apron over the contaminated front surface of the eye protection. Open the apron out fully. Tear the neck tie down the middle, opening it up so that you can place it around your neck rather than over your head. Tie it up so that it sits comfortably and tie the waist strap up as normal. Apply your gloves. You are now ready to re-enter the bay to undertake the next care activity. At the end of your session of care, when you are ready to exit the cohort bay, remove your gloves and your apron. Then wash your hands. Then remove your eye protection. With your clean hands, grasp the elastic strap at the back of your head. Lift the visor up and over the top of your head. Drop it straight into the clinical waste bin. Avoid touching the front of the visor or goggles, as this area will be heavily contaminated. This should prevent the visor from contaminating the front of your clothing. Remove your surgical mask by grasping the elastic ear loops and lifting the mask forwards and off your face. Avoid touching the front of the mask. Wash your hands with water and soap, then immediately leave the bay. Reapply a fresh surgical face mask.